Hello, everyone. It's a quiet afternoon here, and I felt it was the right time to sit down and share something that has weighed heavily on my mind for decades. I've been a doctor for over 30 years, countless hours in the emergency room, and that time has given me a deep, often painful understanding of how people manage a crisis when they are completely alone. The truth is, for those of us past 60, the risk is stark. Most people don't survive their first heart attack if they are by themselves. This is not to scare you, but to prepare you. I've witnessed this fact repeatedly. Why does this happen? It's usually because of hesitation, panic, and a simple lack of preparation. They waste the critical time that we, the medical team, desperately need. I've seen patients arrive where the damage was irreversible, but I've also seen miracles happen, not because of complex surgery, but because the person knew exactly what to do in those first terrifying minutes at home. These are not medical fads. These are basic, science-backed steps that can truly double your chance of survival. I want you to internalize these 7 tips. They are the protocols I wish every senior patient of mine had practiced in their mind. And before we dive in, let me ask you, do you keep aspirin readily accessible in your home? Perhaps in your bedside cabinet or kitchen, just in case? Share your answer in the comments below. I read every one of them. Understanding your level of preparedness is the first step towards safety. We're going to start with the most essential one, the mental and physical anchor, and work our way through. Number 1, the absolute command, remain still and calm. My friends, when that crushing chest pressure hits, your body will scream at you to move, to pace, to seek distraction. But I need you to understand, movement is the enemy. In those moments, your body's natural instinct to panic is literally trying to kill you. The single most powerful survival choice you can make is to enforce complete physical stillness and profound mental calm. Let's understand the biology. Your heart, the muscular pump, is suddenly being starved of oxygen because a coronary artery is blocked. It's in distress. Every tiny muscle contraction, every shift in position, forces that weakened heart to pump harder. It creates an immediate increased demand for oxygen. Oxygen that the blocked artery cannot deliver. This imbalance is what accelerates muscle death. By choosing stillness, you are drastically reducing the cardiac workload to its absolute minimum, conserving precious energy reserves, and buying time. Recall the story of Mr. Henderson, a retired teacher who felt the crushing pain while standing at his kitchen counter. His first thought was to walk to the living room couch. Instead, he forced himself to gently slide down against the counter and lie absolutely still on the cool floor. His wife found him there, conscious and calm, 10 minutes later. The paramedics later confirmed that this immediate choice of stillness minimized his cardiac exertion. Your heart, in that moment, is like a fragile, overheating engine running on the last drops of oil. Stillness keeps it idling gently, preventing a catastrophic seize-up. You are overriding the panic and adrenaline. You are deciding to be deliberate. Tell yourself, clearly and firmly, I have initiated the call for help. The professionals are coming. My one singular, crucial task now is to be perfectly still and wait for them. This mindset, transition is your most powerful tool in reducing the internal chaos. Number 2, focus on slow, deep breathing. Following the command for stillness, we address the internal physiological response, the adrenaline surge. Fear in this context is highly toxic. It releases stress, hormones that immediately raise your heart rate and spike your blood pressure, creating a disastrous positive feedback loop that crushes your already struggling heart. Your immediate countermeasure is this: slow, deep, intentional diaphragmatic breathing. This simple voluntary act achieves 2 indispensable physiological goals. First, it ensures maximum oxygen saturation in your blood, fuel for your starved brain and body. Secondly, and crucially, it actively engages your parasympathetic nervous system, the rest and digest system. This engagement is a direct chemical signal to your body to stop the panic, immediately slowing down that adrenaline rush. I want you to practice this now. Put one hand gently on your stomach, just below the ribs. Inhale very slowly and deeply through your nose, letting your belly push your hand out. Exhale even slower through gently pursed lips, as if you are blowing through a small straw. This deep belly breathing, not chest heaving, is what matters. Aim for that slow, deliberate rhythm, maybe 6 to 8 full breath cycles in a minute. This is crucial. Have you ever tried this technique for anxiety or sleeplessness? Tell me if it helps you find calm in the comments. Sharing your experience helps others see the power of this simple technique. Remember a woman, a retired librarian, who survived her attack primarily by focusing on this breathing. She was alone, scared, but she anchored her mind to the simple physical act of inhaling and exhaling. By the time my team arrived, she was pale but conscious, and her heart rate was significantly lower than we would have expected for her condition. Those steady breaths truly kept her heart from exhausting itself. Number 3, unlock the door and keep your phone beside you. This is a logistical detail that separates life from death. I cannot stress this enough. Make sure your front door is unlocked and your phone is glued to your side. Think about the paramedics rushing to you. Every second they spend having to force or break down a locked door is a second stolen from your treatment time. Eliminate that barrier immediately after making your call. If you cannot reach the door, try to yell out the instruction to unlock the door when speaking to the dispatcher. I recall a tragic case where a man called 911 but collapsed just inside his apartment door before he could unlock it. The crew arrived, heard him inside, but lost 7 precious minutes prying the reinforced door open. Those 7 minutes made the difference. And your phone, this is truly your lifeline. Do not leave it charging in another room. If you try to walk even a few steps to grab it during a severe attack, you risk immediate collapse. Keep it right next to your chair or bed. If you're speaking to the emergency dispatcher, use the speakerphone. If you agree this is a crucial step that every person should follow, please take a moment to hit the like button on this video. It signals to me that this information is hitting home, and it helps this life-saving advice reach more people. Number 4, cough hard if you feel yourself fainting. This instruction requires careful explanation. In those rare, terrifying moments, when you feel the dizzying, nauseating wave of imminent collapse, the sensation of seeing stars, this emergency technique, cough CPR, can buy time. If you are experiencing severe chest pain and you're certain you're about to pass out, you must cough forcefully, deeply, and rhythmically. A powerful, sustained cough generates a momentary, significant surge of pressure inside your chest cavity. This pressure acts like a forceful squeeze, temporary internal pump, forcing blood out of your heart and propelling it up to your brain. This mechanical action can sometimes maintain enough perfusion to keep you conscious during a temporary circulation failure. A few years ago, a retired bus driver alone in his home began to experience an arrhythmia during an attack. He remembered reading about this technique and started coughing forcefully. He later told me that the coughing made him feel strange, but it kept the room from spinning and kept him alert until the paramedics arrived and administered the correct medication. It is a desperate measure, but it is a proven physical trick to keep your brain supplied with oxygen. If you feel that wave of dizziness, take the deepest breath you can manage and then cough as hard and deep as if you were trying to expel something lodged in your lungs. Repeat this cycle every 2 to 3 seconds until the feeling subsides or help arrives. Number 5, loosen all constricting clothing and sit upright. As a physician, I urge you to reduce all physical impediments. The protocol here is straightforward and instantaneous. Release any tight clothing, belts, collars, tight waistbands, and immediately assume an upright or semi-reclined position. Tight clothing restricts circulation, making your heart's already difficult job even harder. Free your body from constriction. Sitting upright is also a simple physiological intervention. Lying flat forces the heart to work against gravity and can worsen congestion in the lungs. By sitting up, you optimize lung function and reduce the overall physical burden on your heart. Here is a perfect example I often share with my patients. Woman, 74 years old, in Florida felt crushing chest pressure while she was gardening. Her first impulse was to collapse onto the grass. Instead, she remembered her doctor's advice. She moved to a sturdy garden chair, quickly unfastened her gardening apron and loosened her waistband and sat upright with her back supported while waiting for the ambulance. Her doctor later told her that decision likely prevented her from fainting and collapsing completely before the paramedics could get her supplemental oxygen. That small conscious adjustment kept her heart from collapsing under unnecessary strain. Give your heart the easiest possible conditions to keep pumping. I'm curious. Do you typically prefer to lie down or sit up when you feel acutely unwell? Let me know in the comments below. Your normal response might be the wrong one in this particular crisis. Number 6, chew aspirin. Immediately, if safe. After calling for help, your immediate pharmacological response is essential. Provided you have no known allergies or doctor's contraindications, you must chew a full-strength aspirin tablet, 320 thoroughly. I must stress chew it. Do not swallow it whole. Swallowing delays the effect by 10 or more critical minutes. Chewing ensures rapid absorption through the mucosal lining of the mouth and the stomach. Aspirin is a highly effective clot inhibitor. Since the majority of heart attacks are caused by a blood clot, taking aspirin immediately starts the process of thinning the blood, prevents the clot from growing larger, and crucially maintains whatever minimal blood flow is possible until you reach definitive care. We had a retired mechanic, who kept aspirin in his garage workshop. When the attack hit, he chewed it immediately while making his call. When he arrived in my ER, his EKG was severe, but the speed of the aspirin had prevented the clot from fully sealing his artery. Made the job of my cardiac team infinitely easier. Number 7, call emergency services immediately. Do not second guess. And, finally, we return to the single most important decision, the action that initiates the entire life-saving cascade. When you feel those symptoms, that crushing pain, the breathlessness, the nausea, the sweat, you must dial the emergency number immediately. Do not wait to see if it passes. Do not try to rationalize it away as indigestion. The tragic statistics show that every minute of hesitation increases the risk of permanent life-altering damage. Time is muscle. We would rather arrive and confirm it is indigestion than arrive too late for an actual coronary event. I saw a patient, a quiet gentleman, who waited 2 hours because he didn't want to call us after 10 p.m. By the time his neighbour found him, the damage was complete and irreversible. Conversely, I've had patients call us for what turned out to be severe heartburn, but their quick action means they would have survived had it been a true attack. Trust your symptoms. Act immediately. My purpose in sharing this isn't to scare you. It is to equip and empower you. These 7 essential steps, from the psychological control of stillness to the immediate logistical call for help, form a comprehensive, self-administered survival map. You cannot predict when an acute event might strike, but you can absolutely control your immediate life-saving response. Before you leave today, I have one more request. Please consider sharing this video with one specific loved one over the age of 60. One share. That small action could be the key to their survival. Stay safe, stay prepared, and remember this professional commitment. Your clarity and knowledge in those first few minutes are the most powerful tool that we, as doctors, can give you to save your own life. Thank you for your time and attention.